Hello, I'm Dr. Saymé, a fertility specialist with more than 30 years of experience. I offer online fertility consultations where we review your medical history and discuss possible treatment options. So in the lab, the same thing that happens in nature is mimicked in the lab. The sperm are washed and then put together with the egg in a certain petri dish where they can do the fertilization. That's the standard IVF. In ICSI, additional step is taken in order to put a single sperm into the egg with a micromanipulator. The main difference between the standard IVF procedure and the ICSI intracytoplasmic sperm injection procedure is that in the IVF, the sperm have to fertilize the eggs without additional help, in contrast to the ICSI treatment. That means that the sperm quality has a very high relevance for the success rate. Of course, in both methods, the egg quality is the most important factor. But if you have the same egg quality and you have weak sperm, then they won't be able to fertilize the egg and the fertilization rate will be lower, or in worst case, fertilization will not occur at all, and then we would have faced the scenario of complete failure of fertilization. So this is the reason what ICSI originally was developed for, to get good results or excellent results for couples where the sperm quality is really not so good. The main reasons for male fertility impairment are very complex, and it's very difficult to give a single reason for that. Of course, there are genetic reasons. Those are relatively few from percentage. It's the one-digit percentage range. Then, of course, if there have been surgeries or accidents in that area, that can also have a prolonged effect on the whole life, because the recovery of the tissue in the testicles where the sperm are produced is not very good. So the sperm development will be impaired even for the rest of the life in worst cases. And in most cases, there can't be given a real reason. What you can do is to give additional support by a good lifestyle and give good supplements, but that's mostly what you can really do. Of course, there is an effect of the sperm on the embryonic development and also on the health of the baby later. So these factors have a reason. So it's important to pick the best sperm for the treatment. And this is done in the laboratory by special preparation routines. Then the likelihood of male-related problems in development can be minimized. If you found this helpful, you can book an online consultation with me. We can review your situation and discuss possible next steps.